All right, today we're going to dive into something pretty cool, a new program that's actually turning your local pharmacy into a frontline defense against heart disease. So how does it all work? Let's unpack it.
Think about that for a second. It's a really powerful idea, right? And it's the whole concept behind this new healthcare initiative, which is designed to make crucial preventative care way more accessible than you ever thought possible. And this is the core message, the thing that drives this whole program. Cardiovascular disease, or CVD, doesn't have to be some inevitable fate. The whole idea is built on the hope that if we act early, we can actually prevent it.
Okay, so to really get why this program is such a game changer, we first have to understand the problem it's trying to solve. And that is the preventable threat of cardiovascular disease.
So why does CVD matter so much? Well, think of it like a domino effect. High blood pressure, which is a huge part of CVD, can kick off this whole chain reaction if it's not managed. We're talking about a much higher risk of things like stroke, heart failure, and, heart attacks. But here's the key word on that slide: treatable.
And that's the thing, right? For most people, the warning signs for a cardiovascular event aren't invisible. They can be spotted, they can be measured, and most importantly, they can be managed if you have the right support.
So, if these risks are manageable, who's going to help you manage them? That's where this gets interesting. Your local pharmacy is stepping up to become a new kind of healthcare ally.
So what is this program? Well, in a nutshell, it's all about bringing healthcare right into your community. It's using the fact that pharmacies are, everywhere, to catch people who are at high risk early on and help them get on a healthier track. It's all about being proactive, not reactive.
Now, you might be wondering, is this for everyone? Well, not exactly. It's designed for a really wide range of adults, but there are some clear rules to make sure it's safe. This isn't meant to replace a specialist. So, for example, if someone has a history of a heart attack or really severe high blood pressure, they wouldn't be eligible. They'd be sent straight to a doctor for the right kind of care.
All right, so let's say you're eligible. What actually happens when you walk into the pharmacy? Let's walk through the assessment process and see how they figure out your personal heart risk. The whole thing is a pretty straightforward 4-step process. First, they just double-check that you're eligible. Simple enough. Then you'll have a chat with the pharmacist about your health history, family history, lifestyle, all that stuff. Step 3 is where they take key measurements, like your blood pressure. And finally, they plug all that information into a special calculator to estimate your risk over the next 5 years. And check this out. This is super important. The program has a built-in safety net. If your blood pressure reading comes back at this critically high level, everything stops. The #1 priority becomes getting you to a doctor right away. See, this isn't about pharmacists replacing doctors. It's about them being a really effective first line of detection. And this whole process isn't just made up on the spot. It's all guided by a really detailed clinical protocol that pharmacists have to follow. So that simple 4-step process we just talked about, it comes straight from this evidence-based guide, which makes sure every single assessment is safe and effective. Okay, so you've got your risk score. But that's just the start, right? Now we get to the most important part. Figuring out what you're going to do about it. It's time for building your action plan.
And the key word here is co-develop. This is so important. The pharmacist isn't just going to hand you a generic pamphlet. It's a partnership. You work together to create a personalized plan that actually makes sense for your life. So what does that plan look like? Well, it's basically built on 2 main pillars. On one side, you've got all the lifestyle changes. Things like diet, exercise, quitting smoking. And on the other side, if you need it, is medication. The pharmacist can even help start or adjust certain prescriptions, like ACE inhibitors, which basically help your blood vessels chill out and lower your blood pressure. And really, the ultimate goal here is a holistic approach. Medication is an amazing tool, for sure. But the long-term dream is to empower you with lifestyle changes that work so well you might be able to reduce your meds, or maybe even get off them completely.
And this isn't just a one-and-done kind of thing either. The program gives you structured, ongoing support. You'll have check-ins after a few weeks to see how things are going. There are major review points like at the 3-month mark to make sure you're hitting your targets. And once things are stable, you'll get reassessed every few years just to keep you on the right track.
So, let's zoom out for a second. What does all this really mean for the bigger picture? Well, this program could be a huge shift in how we think about preventative care. This is about the future of community health. So why is this such a big deal? Well, a few reasons. It makes preventative care super accessible by putting it in a place you already go to. It helps catch risks way earlier than we might otherwise. It encourages pharmacists and doctors to work together as a team. And, maybe most importantly, it puts you in the driver's seat of your own health plan. At the end of the day, this is about so much more than just blood pressure numbers. It's a whole new model for community health. It's about bringing vital care closer to home and asking that really simple question: what if we could actually prevent the crisis instead of just waiting around to react to it?